Elena woke up at 3 a.m. feeling like she'd swallowed a handful of razor blades, a sudden, violent pain that came out of nowhere, slicing through her sleep. She stumbled for water, but swallowing felt like shards of glass tearing her throat apart. She told herself it was just the winter heating, just the dry air drying her out. By morning, the mirror showed a red, angry throat, but she reasoned it away. If it was serious, she thought, I'd feel worse. She didn't want to be the patient who cried wolf. When the fever hit 100.8, she brushed it off. A little Tylenol, a little rest. She had too much to do to sit in an urgent care waiting room for a simple bug. And here was the trap. Her nose was clear. Her chest was empty. Because she wasn't coughing or sneezing, she assumed she was safe from the flu, unaware that silence is strep's signature. The pain faded after a few days, and she thought she'd won. But inside, the bacteria hadn't left. It had just moved, migrating quietly from her throat into her bloodstream. 2 weeks later, the swelling started. Not the normal puffy ankles of pregnancy, but a heavy, fluid-filled retention that wouldn't go down, turning her legs into pillars. Then came the bathroom visit that changed everything. Dark, tea-colored urine, a sign that her body's filtration system was collapsing from the inside out. The diagnosis was a mouthful. Post-streptococcal glomerulonephritis. Her kidneys were under attack, inflamed by the immune debris of the infection she had ignored weeks ago. Deep in her renal filters, the battle she thought she'd skipped was raging, clogging the delicate mesh that kept her and her baby's blood clean. Hooked up to IVs, watching her blood pressure spike dangerously high, the memory of that harmless sore throat returned to haunt her. She realized with terrifying clarity that the danger hadn't been the pain in her throat. It was what the bacteria did after the pain stopped. She had looked for a cough, looked for a cold, and missed the silent predator entirely. She had treated the symptom, but ignored the cause. Now, instead of a simple course of antibiotics, she was facing renal monitoring and a high-risk complication that could have been stopped for $10 and a swab. To protect your kidneys, we have to become forensic investigators of your throat. We need to distinguish the innocent mimic, a viral infection, from the dangerous doppelganger, Group A Strep. First, analyze the onset. Viral infections tend to be polite guests. They arrive gradually over days. Strep is an intruder that kicks down the door. You feel fine at breakfast and terrible by lunch. Next, apply the cough rule. This is your most powerful decoder. If you are coughing, hacking, or have a runny nose, it is almost certainly viral. Strep loves the throat, but hates the lungs. The absence of a cough is the single biggest red flag for strep. If your throat feels like it's on fire, but your chest is perfectly silent, your alarm bells should be ringing. Now, look in the mirror. A viral throat is red and irritated. A strep throat often displays exudate, white, patchy streaks of pus on the tonsils, or tiny red dots on the roof of the mouth. Check the company the symptoms keep. Viral infections bring a posse: runny nose, watery eyes, sneezing. Strep travels alone, focusing all its energy on the throat and lymph nodes. Feel just below your jaw angle. Viral nodes might be tender but diffused. Strep nodes are often large, hard, and painful, like two marbles lodged under your skin. Doctors use the Centaur criteria to score this: high fever, white patches, swollen nodes, and no cough. The more boxes you check, the higher the probability of a bacterial threat. But why does this matter? Let's dive inside to understand the silent mechanism. When strep is left untreated, the bacteria don't just stay in your throat. Strep bacteria are masters of disguise. They use molecular mimicry, wearing proteins that look suspiciously like your own body's tissues to hide from your immune system. Eventually, your body gets wise and launches a massive antibody attack. It fires weapons at the bacteria, creating a chaotic battlefield in your bloodstream. The debris from this battle, clumps of antibodies bound to bacterial parts, forms what we call immune complexes. These are sticky, heavy biological snowballs drifting in your blood. These complexes travel down to your kidneys, specifically to the glomerulus, the microscopic high-tech mesh filter responsible for cleaning your blood. Here is the catastrophe. The complexes get stuck, They're too big to pass through the filter, so they clog the mesh, triggering massive inflammation. This is post-streptococcal glomerulonephritis. Your own immune system, trying to clean up the strep, inadvertently destroys the kidney's filtration ability. As the filter fails, it starts leaking things it shouldn't. Blood and protein escape into your urine, turning it dark, while toxins and fluid back up into your body. This fluid retention drives your blood pressure up, creating a hypertensive crisis that puts both you and your baby's placental blood flow at risk. The tragic irony is that this entire cascade, from throat to kidney failure, is preventable. You have a roughly 9-day window to treat the strep and stop the complexes from forming. The takeaway is absolute. You cannot distinguish strep from a virus by pain level alone. You must look for the pattern: sudden fever, no cough, white patches. Maya woke up to the same razor-sharp pain that had trapped Alina, but her reaction was fundamentally different. She didn't hope it would go away. She went looking for answers. She grabbed a flashlight and performed the mirror check immediately. She wasn't looking for redness. She was hunting for the specific white patches of bacterial activity. She ran the mental checklist. Her throat was screaming, but her lungs were silent. No cough, no runny nose, just pure, isolated throat pain and a rising fever. She knew these signs pointed away from a cold and towards strep. Instead of reaching for a lozenge to mask the pain, she reached for her phone to solve the problem. She called her provider with specific data. I have a high fever, white spots on my tonsils, and absolutely no cough. I need a rapid strep test today. Because she advocated for the test, she was in the chair within hours. The swab took 5 seconds, a momentary discomfort that would define the safety of her pregnancy. The test was positive. The diagnosis was confirmed before noon. Her doctor prescribed amoxicillin, a standard pregnancy-safe antibiotic that neutralizes the bacteria effectively. Inside her body, the medication went to work immediately. It dismantled the strep bacteria swiftly, preventing her immune system from needing to launch the chaotic counterattack. Because the bacteria were destroyed early, the dangerous immune complexes never formed. Her bloodstream remained clear, and her kidneys were never put under siege. 24 hours later, she was no longer contagious. The pain was receding, not because she masked it, but because she eliminated the cause. By treating the infection in the window of opportunity, she protected her kidneys from failure and her baby from the stress of a maternal health crisis. Maya proved that in pregnancy, the most powerful tool you have isn't just your endurance, it's your ability to recognize a red flag and act on it. Let's consolidate this into your safety toolkit. Use the strep checklist to decode your symptoms: high fever, white patches, swollen nodes, and most importantly, the absence of a cough. Think of the cough as your traffic signal. If you have a cough and congestion, the signal is likely green for a viral cold. If the cough is missing, the signal is red for potential strep. If you confirm strep, antibiotic treatment is not optional. It is the only way to prevent kidney damage. Viral infections, however, need rest, hydration, and saltwater gargles. A critical hygiene tip: if you test positive, throw away your toothbrush 24 hours after starting antibiotics. Reusing the old one can reinfect your throat immediately. Watch your kidneys closely in the weeks following any throat infection. If you notice dark cola-colored urine or sudden puffy swelling in your face or hands, call your doctor instantly. Head to the emergency room immediately if you experience difficulty breathing, if you are drooling because you cannot swallow, or if you are too dizzy to stand. Your pregnancy rule is simple: test, don't guess. A 5-second swab can distinguish between a harmless virus and a kidney-threatening bacteria. Every pregnancy is unique. Always prioritize your doctor's specific advice over general education. If you are worried, make the call. Stay vigilant, trust your instincts, and advocate for the simple tests that keep you and your baby safe. Please review the following medical safety disclaimer and emergency indicators carefully.